As far as I understand, Shokuiku is a Japanese term which means food education. The philosophy was designed to encourage healthy eating and sustainable eating habits and attitude towards foods. This philosophy is taught to the children at a very young age, and they carry the philosophy throughout their life with other good moral values instilled on them. In Malaysia, we do have a similar concept of encouraging healthy eating amongst our community, including children, through our healthy eating advocacy and promotion. However, it is not backed up by law like basic law of Shokuiku in Japan. Therefore, it is important that the concept of Shokuiku be adapted or adopted in Malaysia or any other country to instill good eating habits from young. This is particularly important in time where we are facing the double burden of malnutrition, whereby undernutrition such as stunting and wasting coexist with other overnutrition which are overweight and obesity.
During two sessions of Look East Policy Program LEP2.0 that have been attended by officers and relevant ministries and agencies, we gain a lot of knowledge and experience that can be adapted and adopted in Malaysia. We could see the Shokuiku in Japan was a synergized effort from various sectors and social societies in promoting healthy eating at a various setting. The approaches in delivering nutrition awareness, especially to young age, were very creative, fun learning and hands-on. Thus, Shokuiku also inculcate good eating habits among young children and teach a proper manner during mealtime. The teachers also played main role and lead by example for the children. They will eat the same meal as the children at the center or schools. On top of that, we also learn the importance to establish a diet and nutrition teachers system with a placement of registered nutritionists at schools, so that the nutrition education at school shall be conducted by a registered nutritionist. Other than that, we also learn in Japan that they promote the inheritance of traditional foods and emphasizes the local produce in their daily consumption. Shokuiku also was integrated into other food premises such as convenience stores, restaurants, and cafeteria at workplace by promoting healthy and balanced meal at affordable price.
Before I explain about ongoing Shokuiku activities in Malaysia, I would like to touch a bit on our National Nutrition Policy of Malaysia, which strives to ensure that the well-being of nation is achieved and maintained through nutrition. The strategies outlined in this policy were translated into programs and activities in the National Plan of Action for Nutrition of Malaysia (NPANM). Therefore, the ongoing Shokuiku activities conducted in Malaysia is in line with the mission and vision of the National Nutrition Policy of Malaysia and the strategies and activities of the NPANM. The Shokuiku concept has been integrated into method of teaching nutrition education to our children using interactive methods and appropriate approach according to their age. We have also integrated nutrition component into our local community garden projects, which involve children at childcare centres and kindergarten. This is one of the learning methods used to expose them to the environment outside the classroom. This activity is being carried out with the collaboration from Department of Agriculture and Community Development at state level.
We have already mass-produced actually and ready to be distributed to the childcare centre about the My Healthy Tummy apron that was adapted from the Shokuiku apron to educate the children on the importance of consuming balanced diet, but also in the proper serving sizes or portion size, and also the basic concept of a digestive system. We also have mass-produced and readily to be distributed the magnetic board My Healthy Plate that was adapted from the 5-a-day model, and this material is actually can be used to educate the children on how to properly fill in their plate according to the food groups. And both educational material is being used by all government kindergarten and all public health nutritionists operating in the community level. I'm very happy to share that the acceptance of the children towards the interactive materials that have been developed is very encouraging, very highly positive and motivating for us to proceed even further with our plan of action.
Based on the study visit and also knowledge and experience acquired from Japan, we will try to integrate the Shokuiku concept in our policy and national plan. For example, we are in the midst of preparing a proposal to set up a healthy central kitchen in early childhood care and education (ECCE) institutions. This is to ensure that the food served to the children at the centres are nutritious and safe. We believe that healthy eating can be nurtured at young age. We are also advocating on the expansion of school meal programs to all primary schools to ensure availability of nutritious foods at school. Besides that, we also plan to promote local crops for local people to ensure the availability and accessibility of food at affordable price. This initiative needs a strong collaboration from the respective ministries and agencies. Last but not least, we also plan to empower elderly as an agent of change in advocating healthy eating messages to all age group.
The Shokuiku Approach in Japan is one of a good model in improving nutritional status of the population. This approach seems also can help in Japan's life expectancy over the year. We hope that we can strengthen our collaboration with Japan through JICA in the future in improving Malaysia's health status.